Cholera is an acute, severe diarrheal infection of the small intestine caused by the bacterium Vibrio cholera. The infection is often mild or asymptomatic, but in its severe form, it can be life-threatening due to rapid and extreme fluid loss. The causative agent of cholera is the bacterium Vibrio cholerae, specifically serogroups O1 and O139. This microbe is a gram-negative, curved rod or comma-shaped bacillus that is highly motile due to its monotrachous flagellation. It is categorized as a facultative anaerobe and tests negative for the coagulase enzyme. The disease is caused when this bacterium produces the potent cholera toxin, an enterotoxin that disrupts intestinal function. The transmission of cholera is primarily through the fecal-oral route, as the disease is both waterborne and foodborne. The most frequent source is contaminated water, often from public wells or stored water tainted by the feces of an infected person. Additionally, the disease spreads through the consumption of contaminated food, such as raw shellfish or fruits and vegetables washed in unsafe water. The entire process is greatly exacerbated by poor sanitation and hygiene, as the bacteria thrives in environments lacking adequate sewage treatment and access to safe drinking water and proper hand-washing facilities. It's important to note that person-to-person transmission is rare, as a high number of bacteria is usually required to cause infection. The clinical presentation of cholera typically follows a short incubation period of 1 to 3 days. The disease is characterized by the abrupt onset of painless, profuse watery diarrhea and frequent vomiting, often accompanied by muscle cramps and restlessness. The classic sign is acute watery diarrhea, commonly referred to as rice water stools due to the stool's pale, watery appearance with flecks of mucus, notably lacking fecal odor or blood. The primary danger stems from the rapid and voluminous fluid loss, which quickly leads to severe dehydration and loss of electrolytes, which can result in life-threatening complications, including hypovolemic shock, metabolic acidosis, acute kidney failure, and potentially death within hours without prompt treatment. The investigation and diagnosis of cholera rely primarily on clinical suspicion during an outbreak, but laboratory confirmation is crucial for accurate surveillance and control. The gold standard for diagnosis is stool examination and culture, which involves culturing the causative Vibrio cholerae bacterium to identify the pathogenic serogroups. For rapid results in remote settings, rapid diagnostic tests, such as dipstick tests, can quickly confirm the presence of cholerae antigens. Additionally, blood tests are vital for assessing the severity of the patient's condition by measuring electrolyte imbalance, blood urea nitrogen, and creatinine, which are indicators of the extent of dehydration. The cornerstone of cholera management is prompt and adequate fluid and electrolyte replacement to counteract the severe losses caused by diarrhea. This is primarily achieved through rehydration therapy. For mild to moderate dehydration, the patient is given frequent, large volumes of oral rehydration solution. For severe dehydration or shock, intravenous fluids like Ringer's lactate are crucial to rapidly restore circulating blood volume. While not the primary treatment, antibiotics such as doxycycline, azithromycin, or ciprofloxacin, depending on resistance, are recommended for severely ill patients to shorten the illness, decrease diarrhea volume, and limit bacterial shedding. Finally, zinc supplementation is recommended for children as an important adjunct to help lessen the duration and severity of the diarrhea. Cholera prevention is a multi-tiered strategy organized into 3 levels, focusing broadly on water, sanitation, and hygiene. Primary prevention aims to reduce exposure to the bacterium through measures like ensuring universal access to safe water, improved sanitation and waste disposal, promoting good hygiene practices such as hand washing, and administering oral cholera vaccine in high-risk areas. Secondary prevention focuses on stopping the disease's progression and spread by utilizing rapid diagnosis and surveillance, providing immediate treatment at the first sign of illness to prevent dehydration, and isolating cases to prevent environmental contamination. Finally, tertiary prevention aims to manage complications and restore function, which includes providing post-recovery nutritional rehabilitation for severe effects like acute kidney injury, thereby enhancing the overall community resilience against future epidemics. Before we go, please remember to prioritize your health and the well-being of your community. Cholera is preventable by maintaining good hygiene, drinking safe, treated water, and ensuring food is properly cooked and stored.